Hello and welcome back to my channel. Today we're discussing Meniers Disease, a chronic inner ear disorder that affects balance and hearing. This condition can be unpredictable, causing episodes of vertigo, ringing in the ears, and hearing loss. While Meniers Disease is not life-threatening, its symptoms can significantly impact daily life, making simple tasks difficult. Understanding the symptoms, diagnosis, and management of Meniers Disease is crucial for those affected by it. Many individuals experience sudden attacks of vertigo, which can last for several minutes to hours, leaving them feeling disoriented and nauseous. The condition is believed to be caused by an abnormal buildup of fluid in the inner ear, but the exact cause is not always clear. While there is no cure for Meniers Disease, there are several strategies to help manage symptoms, including lifestyle changes, medications, and in some cases, surgical options. By learning more about the condition and working closely with a healthcare provider, individuals with Meniers Disease can find ways to reduce the frequency and severity of their episodes. Hi, I'm Dr. Knapp, family medicine physician, here to bring you medical information so you can take control of your health and make the most of your doctor visits. Let's get started. Meniers Disease is known for its unpredictable nature. The primary symptoms include vertigo, hearing loss, tinnitus or ringing in the ears, and a sensation of fullness or pressure in the affected ear. These symptoms often occur in episodes with periods of normal function in between. Vertigo is the most disabling symptom of Meniers Disease. During an episode, individuals experience a spinning sensation, making it difficult to stand, walk, or focus. Vertigo attacks last anywhere from 20 minutes to several hours, often leading to nausea, vomiting, and feelings of motion sickness. These episodes can be spontaneous, occurring without warning, and may be triggered by stress, fatigue, or dietary factors. Hearing loss in Meniers Disease typically affects one ear, though in some cases both ears can be involved. The hearing loss is often fluctuating, meaning that it can improve between episodes, but over time it may become more permanent. Many individuals describe difficulty hearing low-frequency sounds or feeling like sounds are muffled. Tinnitus, or ringing in the ear, is another common symptom. This can present as buzzing, humming, or roaring noise in the affected ear. The intensity of tinnitus can vary, sometimes becoming louder during or before vertigo attacks. A sensation of fullness or pressure in the ear, known as aural fullness, is also common in Meniers Disease. This feeling is similar to what one might experience during changes in altitude, such as when flying or driving through the mountains. It can be an early warning sign that an episode is about to occur. Symptoms of Meniers Disease can be unpredictable, with some individuals experiencing frequent attacks, while others may go months or even years between episodes. Over time, the condition can lead to progressive hearing loss and balance issues. Diagnosing Meniers Disease can be challenging because its symptoms overlap with other inner ear disorders. There is no single test that confirms the condition, so healthcare providers rely on a combination of medical history, symptom assessment, and diagnostic tests. A healthcare provider will begin by discussing the patient's symptoms, including the frequency, duration, and severity of vertigo episodes. They will also ask about hearing changes, tinnitus, and any factors that may trigger symptoms. A detailed medical history is important to rule out other possible causes of balance and hearing problems. Hearing tests, such as an audiogram, are commonly used to evaluate hearing loss. Individuals with Meniers Disease typically show hearing loss in the low frequency range, which is different from other types of hearing loss that often affect higher frequencies first. Balance tests may also be performed to assess how well the inner ear is functioning. One common test is the vestibular evoked myogenic potential, or VEMP test, which measures how the inner ear responds to sound stimuli. Another test, called electronystagmography, or ENG, evaluates eye movements in response to changes in position, helping to detect inner ear dysfunction. Imaging studies, such as MRI, may be ordered if a healthcare provider suspects another condition, such as a tumor affecting the auditory nerve. While an MRI does not diagnose Meniers Disease, it helps rule out other possible causes of symptoms. Because Meniers Disease is a clinical diagnosis, meaning it is based on symptoms rather than a definitive test, an accurate diagnosis often requires a careful monitoring over time. Keeping a symptom diary can be helpful in tracking episodes and identifying potential triggers. There is no cure for Meniers disease, but several treatment strategies can help manage symptoms and reduce the frequency of attacks. The goal of treatment is to control vertigo, preserve hearing, and improve quality of life. Lifestyle modifications are often the first step in managing Meniers disease. Many individuals find that dietary changes can help reduce symptoms. A low-sodium diet is commonly recommended to decrease fluid retention in the inner ear. Limiting caffeine, alcohol, and nicotine can also help, as these substances can affect the inner ear function. Staying hydrated and maintaining a consistent sleep schedule can further improve symptom control. Medications play a key role in managing Meniers disease, particularly for controlling vertigo and nausea. During an acute vertigo attack, medications such as meclizine or diazepam may be used to reduce dizziness. Antiemetics such as promethazine can help relieve nausea and vomiting. Some individuals benefit from diuretics such as hydrochlorothiazide, which help reduce fluid buildup in the inner ear and may decrease the frequency of attacks. For individuals with frequent vertigo episodes that do not respond to medication, more advanced treatment options may be considered. Vestibular rehabilitation therapy can help improve balance and reduce dizziness by training the brain to compensate for inner ear dysfunction. This therapy is especially useful for those who experience lingering balance problems between vertigo episodes. In some cases, injections of corticosteroids or gentamicin into the middle ear may be used to control severe vertigo. Corticosteroids help reduce inflammation and can provide relief without affecting hearing. Gentamicin, an antibiotic, can be used to partially damage the balance function of the affected ear, reducing vertigo attacks. However, it carries a risk of worsening hearing loss, so it is typically reserved for cases where vertigo is disabling and other treatments have failed. I just want to take a moment to ask that you hit that like button and subscribe to my channel. Leave a comment below if you have any questions or topics you want covered in future videos. Anyway, for individuals with severe treatment-resistant Meniers disease, surgical options may be considered. Endolymphatic sac decompression surgery is a procedure that aims to relieve pressure in the inner ear and reduce vertigo episodes. Another option is vestibular nerve section, where the nerve responsible for balance is cut to eliminate vertigo while preserving hearing. In extreme cases where hearing is already significantly impaired, labyrinthectomy surgery may be performed to remove the balance function of the inner ear. Hearing aids can be beneficial for individuals with Meniers-related hearing loss. These devices amplify sound and improve communication, helping to minimize the impact of fluctuating hearing changes. Tinnitus management techniques such as sound therapy or cognitive behavioral therapy can also help individuals cope with persistent ringing in the ears. Because Meniers disease can be unpredictable and disruptive, psychological support is an important aspect of management. Support groups, counseling, and stress reduction techniques can help individuals cope with the emotional challenges of living with a chronic condition. So, Meniers disease is a complex inner ear disorder that causes episodes of vertigo, hearing loss, tinnitus, and ear fullness. Symptoms can be unpredictable, making daily life challenging. While there is no cure, a combination of lifestyle changes, medications, and therapy can help manage the condition and reduce the severity of symptoms. Diagnosis is based on a thorough evaluation of symptoms, hearing tests, and balance assessments. Treatment varies from dietary modifications and medications to physical therapy and in some cases surgical interventions. Working closely with a healthcare provider is essential to finding the most effective treatment approach for each individual. If you or someone you know is experiencing symptoms of Meniers disease, seeking medical attention early can help improve management and prevent long-term complications. Thank you for watching. As always, take care of yourself and make the most of your day.